On the cold morning of November 2nd, 2007, over 400 people from across Madison County came to our free drive-through flu shot clinic. We gave shots as people sat in their cars. Our patients included busy mothers doing household errands, school bus drivers, farmers on their way to market, and older folk who didn't want the hassle of parking and getting out in the weather. During this 4-hour exercise, Madison County Health Department staff and volunteers went into high gear to practice for the possibility of quickly providing medicine or vaccines to every citizen in the county. In addition to testing our emergency plans, we reached segments of the community that may not otherwise receive a flu shot, such as those without insurance. This exercise incorporated some of our community partnerships. The Health Department could not accomplish a large county-wide response without community response partners at the Emergency Management Agency, the Richmond Police Department, and our Medical Reserve Corps. They all came through with solid support. It was a learning experience for all of us, including public health students from EKU who got first-hand experience in mobilizing resources in an extraordinary way to meet community needs. People rely on the health department for immunizations. In a public health emergency, such as a new strain of pandemic influenza, when the entire population would need to be immunized, we would provide shots like we do every day, except we would do it more quickly and in greater volume. Vehicles entering the Lake Reba complex entered from Highway 52 through the Lake Reba Drive Park entrance. From there, they traveled the half-mile length of the park to arrive at the drive-through clinic located in the Little League baseball parking lot. Traffic entered the clinic, stopping briefly to receive paperwork and instructions before being directed into the first drive-through tent. Here, patient paperwork was reviewed and the vehicle detained. All vehicles were required to be in park at all stops. Next, the patient moved to the second tent, where the vaccine was administered. Vehicles or patients requiring special attention were directed to a fourth drive-through lane. Here, needs such as foreign language translation, large vehicle service, multiple patients, and special medical attention could be met. Very large vehicles such as buses were directed around the clinic perimeter, and the patients escorted to the special needs tent by health department personnel. After completing vaccination, patient vehicles were directed to the clinic exit. Here, the patients were stopped a final time. Each patient was asked whether or not they were pleased with the drive-through clinic experience and if they felt well. The average service time for each vehicle was 4 minutes. There were no dissatisfied customers. Now let's briefly follow patient vehicles through the clinic and listen in on some of those who attended.
Have you ever had Guillain-Barré syndrome? Have you ever fainted after a shot? Do you have any other medical questions? And what I want you to do is fill out the top part with your name and address and phone number, and you keep the pen. And this is your sheet. It tells you all about the flu. And when you get up there, they'll direct you to where you need to go. And if you wouldn't care to have your arm out and have it ready, and it has to be from your shoulder down, so it has to be up far enough to where they can get you, okay? Okay.
Two get shots. One. Some paper towels. Pull up there through that blue tin up on the far end of the lot behind that fence.
Hi, there you. All right. You got your paper filled? Check, make sure it's filled out. They'll need you to sign and date it there for me, please. That's okay. Please put your car in park. Thank you.
Go and just relax that arm down there. He'll poke. Put your Band-Aid on.
Our clinic was planned and operated in accordance with the National Incident Management System. As you can see here, a complete incident command chart was prepared during planning, and many health department personnel had important roles to play. The lead command positions consisted of Jim Rousey as the incident commander, Carla Bowman as the operations section chief, Carol Gillum as the Planning Section Chief, Ruth Davis as the Logistics Section Chief, and Dina Childers as the Finance Chief. While these are the most prominent positions, every person taking part in the operation is represented in this chart in an effort to maintain the optimum span and control ratio of 1 to 5.
I was well pleased that we had a good turnout initially, and that allowed us to identify some weak spots. We had a bottleneck, so identifying that bottleneck has given us an issue that we'll need to work on as we evaluate this. But overall, I think we're well pleased with how things are doing. People are doing what they do every day, but just doing it in a different environment. And of course, the big issue this morning is everyone staying warm and pens not freezing up.